Right now, a small but serious threat is spreading across the US, kissing bugs. These blood-feeding insects can carry a parasite called Trypanosoma cruzi that causes Chagas disease. The CDC now reports kissing bugs in 32 states, with confirmed human cases in several states, including California and Texas. Many infections start silently: mild fever, fatigue, a swollen eyelid called Romarca S sign, then years later can harm the heart or digestion in up to 20 to 30% of people if untreated. Eggs, diets. No, today is senior safety, what it is, where it's spreading, and exactly how to protect yourself. Meet Senior Maria, 71. She noticed a painless bite near her face after an evening on the porch. No rash, felt fine until one eye swelled the next morning. She didn't panic. She called her doctor, mentioned possible kissing bug exposure, and got tested. Early care matters. That's the whole point of this video. Know the signs, act early, stay safe. What are kissing bugs? Flat, dark brown, black, often with red-orange edges, a pointed cone-shaped head, long thin legs. They feed at night around the face, then may defecate near the bite. If feces are rubbed into the bite, eye, mouth, the parasite can enter. We'll keep it simple: what to watch for, where they are, and your step-by-step protection plan. Next, where the risk is rising and how exposure actually happens at home.
Kissing bugs have now been reported in 32 U.S. states. Confirmed human cases include California, Texas, Arizona, Louisiana, Missouri, Mississippi, Arkansas, and Tennessee. In California, sightings cluster around the Sierra Nevada foothills and the desert edges near Los Angeles and San Diego. In Texas, positivity rates in sampled bugs are high, and kennels have reported infected dogs, so pets are part of the story. How exposure happens: warm nights, porch lights, open screens, cracks in doors or windows, pet bedding near outdoor walls. Bugs are attracted to CO and light. Slip in through gaps and feed while you sleep. Immediate action checklist: senior friendly. Pre-check your home. Repair or replace window and door screens. Seal cracks and crevices. Reduce bright outdoor lighting at night. Pet protocol: keep pet sleeping areas clean and away from exterior walls. Don't leave pet food outside overnight. Ask your vet about Chagas risk in your area. Outdoors camping: use raised sleeping cots. Keep wood piles and debris away from the house. Store firewood elevated and dry. If you see a suspicious bug, don't crush with bare hands. With gloves, place it in a sealed container or bag. Contact local health authorities or pest control for identification and testing. Example: Senior Tony, 70. He enjoyed evening porch time with his dog. After sealing door gaps, installing tighter screens, and moving the dog bed indoors at night, he stopped finding bugs near entryways. Small fixes brought big peace of mind. Coming up next, what to do in the first 24 to 48 hours if you bitten or even suspect exposure. Which tests matter, and what treatment window you need to know.
If bitten, possible exposure: do not scratch. Wash the area with soap and water. If eyes are involved, rinse gently with clean water. Avoid rubbing. Document: note date, time, location, and symptoms. If possible, keep the insect sealed in a container with gloves. Call your doctor and mention possible Chagas exposure. Ask about a Chagas blood test if you have compatible symptoms or credible exposure. Early testing is key. Early symptoms: days, weeks: mild fever, fatigue, headache, eyelid swelling, Romarca's sign, local redness. Chronic risks: years. About 20 to 30% may develop heart rhythm problems, heart failure, or digestive enlargement if untreated. Treatment: antiparasitic medications such as benzonidazole or nifurtimox can be prescribed by a clinician and are most effective early. Don't self-medicate. This must be doctor-managed care. Home protection plan posted on the fridge. Weekly, check and repair screens. Vacuum window sills and door frames. Clear clutter near walls. Night routine: minimize porch lights. Keep doors closed. Bring pet beds and food indoors. Yard: trim vegetation touching the house. Elevate and cover wood piles. Seal gaps around utility lines. When to seek care: immediately. Fever plus eyelid swelling after a facial bite. Persistent fatigue with known exposure. In France, pregnant women or immunocompromised individuals with any suspicious symptoms. Myths, quickly, only travelers get chagas, gives false, there are domestic transmission cases. Crushing the bug solves the problem, gives false, crushing increases infection risk. Catch safely, report, and test, the goal isn't fear, it's preparedness. Seniors who know what to look for, how to seal their home, and when to call the doctor avoid the real danger, late diagnosis. Final word, if you live in or travel to affected states, make the simple fixes today. Teach your family and neighbours. And if you think you've been exposed, call your clinician early, the treatment window matters, stay alert, not afraid.